I always wanted to be a doctor from when I was in fourth grade. So it was a dream of mine. I read a book about Elizabeth Blackwell, the first woman doctor, and I wanted to do what she did. And no one else in my family is a doctor, so I don't think I really understood what doctors do, but I had a vague idea that they help people. So I had planned on going into internal medicine. And then when I hit the wards, kind of really started seeing patients as a third year medical student, I was very surprised. Like, is this what it is? And one of my first rotations was in primary care. It was an outpatient internal medicine, outpatient sort of primary care internal medicine practice. I wrote this book really from the patient side. And I say that not in an imposter syndrome way, but just to make clear that I'm not an expert in communication. There's lots of research also in communication experts. I'm not one. Also, there are a lot of articles and science behind empathy, clinical empathy, relationship-centered care, patient-centered care. And also, I'm not an expert on any of that. My son is deaf. He's 11 now, and he has age-matched oral speech and language. But it was a journey to reach that. And we only got there through him having surgery to have cochlear implants. He has cochlear implants bilaterally on both sides. And then we went through 4 years, an intense 4 years of auditory verbal therapy is what that specific field is called. And it's home-based in the sense that you have homework every day. And the idea is you need to bathe that child or whoever received the cochlear implant and needs to grow their language, or you want them to grow their language. Because I will, quick caveat, say that, or not caveat, quick disclosure, I don't have anything against the capital D deaf community, and I don't want to come across as an ableist. There is great value to the capital D deaf community. And I say capital D because my son is deaf with a small d. We right now are not part of deaf culture, and deaf culture is with a capital D. And that's just a time factor and a factor of we don't really know anyone else who's deaf, and we're trying, but COVID kind of has really put a stop to that. And we were learning sign language during COVID, and now that life has sort of gotten a little bit more on track, we've paused that. But I do want to introduce our whole family more and more into deaf culture and enable my son to have access to that identity if he wants it. But I do think of it as the same, that I'm Korean by ethnicity, but I'm American. I was born in the US, and English is my first language and the language I'm most comfortable in. I do speak Korean, but I'm uncomfortable in it. It's not, certain things are system one language. A lot of things I need to think extra about it, and it's harder. So for him and me, our whole family, to use sign language now, it's like system two work. And so in that sense, auditory verbal therapy, the goal was to make oral speech and language a system one thing for him. And that was a choice just because English is my first language, and I think that could be called ableist, but it was a factor of how long will it take me to become fluent in sign language? That's probably at least 5 years. If I had a crash course, maybe even 2 years. If I had tried to become fluent in sign language when he was diagnosed, which was at age 2, and it took me 2 years, I wouldn't be fluent until he's 4. That's a lot of language time lost. So we were recommended, well, if oral speech and language is your goal, then you go for it and you use auditory verbal therapy. And so that is the choice that we made, because then even just me, right? If I do a crash course for 2 years in sign language, what about his sister? What about his father? What about his grandparents? You know, how long will it take, if ever even, someone to be willing to become fluent? And then, there's the community. What about then the community? And it sort of maybe changes the choices that you make for life. But so in getting his diagnosis, he was misdiagnosed. At 9 months and 13 months of age, we went and had his hearing evaluated, and he did have newborn screening. In the US, it's standard, and he had it. It's not like that any mistake was made there. But he was misdiagnosed at 9 months and 13 months. And I was told his hearing is normal because he had the wrong testing at that time. He had auditory sound booth testing, and the testing he really needed to get his diagnosis of auditory neuropathy is an ABI, an auditory brainstem index test. And so he was diagnosed at 22 months of age. And I was anxious for the week leading up to it. I mean, I think I already knew that there was something wrong at that point, and knew that I had been falsely reassured. Not that I'm pointing fingers, but so just my anxiety, but that emotion is super high in me. And so then when I get the diagnosis and he's still asleep because he had to go under general anesthesia to have the test, the doctor's talking to me, and I was still able to hear everything and listen to everything she said, but I was just crying, like tears were running down my face, and she didn't say anything. She did give me a box of Kleenex. I don't think she didn't care about me, but she didn't say anything. And I realized later, like, it would have been nice had she said, I know I can tell you're really upset about this, and just say something. And she doesn't have to figure out how to stop me crying. I don't know, just there was no acknowledgement, no verbal sort of auditory sense of empathy. She did give me the box of Kleenex, and I don't think that she's an uncaring person or anything. So, but then I thought, I'm still like, okay, it's fine. And I felt like, oh, I shouldn't be crying in front of the doctor. I need to pull it together. And not that I was blaming myself, but there was no expectation that there would be any sort of connection like that in this interaction. And then I spoke to one of my mentors later because I was still crying. And somehow, I don't know exactly why I called her, I didn't have a plan, like I need X, Y, and Z from her. She's a dermatologist. It's not like she has expertise in deafness or hearing or anything, but she's super smart, and not only smart, but a real person. And it was the right thing to do to call her in retrospect, because I'm crying and I say to her, I feel stupid for crying. This is not a fatal diagnosis. And I think even then, not being an ableist and thinking, oh, this is a tragedy, he's deaf. It was just kind of like, I was just sort of in shock and fear and still anxiety. Like, what do we do? There's still going to be all these, decisions we have to make. And I was just crying, I think, from a sense of just anxiety, really. And she says to me, well, of course you're crying. You're only human. And even now I pause, because it's like, did I ever think I'm not a human being? Of course I'm a human being, but I think that's what is meant to me by bearing witness to someone else's humanity, is to just keep in mind that that person is human. And I think emotions and being able to name our emotions is uniquely human. And that's the piece, I think, that is crucial to having connection. I think, I'm not sure, you can never go back, but I think if I had just heard her say, this is probably really distressing to you, I see you crying, that's normal, I think then I would have felt like, okay, maybe I would have stopped crying even then, because she would have acknowledged my humanity. So the book didn't come right away because we were under stress. I was underwater. I was overwhelmed. I had a lot of stuff to do. But once he reached age-matched speech and language, there was maybe a year, 2 years where I was like, okay, and I was just decompressing from a lot of stress, repairing some of the relationships that I had let go, and not purposefully, but I was just stressed and overwhelmed and made a lot of mistakes. and I was journaling and writing, and really my intent was not, oh, I'm going to write a book about doctor-patient connection, and it wasn't like a conscious thing, but in some ways initially it was an activity to do with my sister. I have an older sister who I'm very close to, and it was like, we don't have enough time to spend together, let's do a project together. And she's a psychologist, so I was like, I've been reading these books, these concepts are really important, but I can't put them into action yet because they're so new to me, but I think maybe writing about them will probably help me, and then you can help me too with your psychology and all your knowledge. And so it was interesting because in a way she was like, I can't write this book. She's like, this isn't my field. I was like, no, this isn't my field. But with her help, and with David Caruso was very, very, very helpful to me. He's affiliated with Yale. He's an emotion researcher. With Peter Salovey, who's actually the president of Yale University, they did a lot of pioneering work in emotion research, and he helped me with the emotional data, emotional awareness chapters, and it sort of just developed. And I realized through the writing of it how important this topic is to me. But I will say that it was through the writing of it that I realized fully how many layers there are and why it's so difficult. And sort of joking, but there's truth to it, I like to say, I tell myself, but it's a positive way. I think people, when they hear me say it, they think I'm beating myself up, but I say, I'm totally remedial in all of this stuff, I realize. Because even actually observing the seeing part, the dermatology, the dermatopathology part, I never felt like it came naturally to me. For me, it always felt like work. But it was joyful work. It was work that I was willing to do. And so similarly, the emotion work, I grew up, I'm Korean, my family, we never, I love you, not even on the table. The only emotion we ever really talked about was like, why are you so mad? Like, why are you mad today? And I would say, I'm not mad. But then I would be mad as soon as my mom would say, why are you mad? I'm like, now I'm mad. So, but there's actually millions of emotions, right? There's countless emotions. So a good place to start being remedial is there's 5 universal emotions. And it still takes me time to think, wait, what are those 5 again? But I've started with fear, anger, happiness, and sadness. 4. And for me, really, I realized fear is probably one of the things I feel first and just overwhelms me. So I actually started with fear. And I've tried to graduate to then sadness. Because oftentimes what I interpret as anger or fear for myself, anger or sadness for myself actually began as fear. And for me, I think initially I quickly converted to anger, because I think that is my system 1 emotion, because I think that's what I grew up with. Like, oh, you're mad. And so I'm thinking, oh yeah, okay, people get mad. That's normal, that's natural. So without thinking about it, I'm like, that's the emotion, anger. And so when my mom says, why are you angry? I'm like, okay, now I'm angry. But I think a lot of times she hears sadness or fear in my voice, and she'll say that's anger. And then it's easier for me to say, okay, now, or just immediately, yeah, now I'm mad. And I don't want to evaluate what is she really hearing in my voice, because she's my mom and she can tell that there's something wrong with my voice. And I'm remedial. It's not natural for me or comfortable for me to think, step back and be like, that awareness, wait, what does my voice sound like? What is going on with me? What does she hear? And I realize it's easier to become angry. So that type of thing, I think this type of thinking, the book has really helped me, because it's for doctor-patient, it's directed for doctor-patient, because that's sort of secret or not. The publisher says, you're a doctor, it's for doctors. And they're saying it's just for doctors. I'm okay, if doctors read it, great. I really want patients to read it too, because I think patients can demand this connection from their doctors. It's not being rude, because you're not saying, doctor, you need to spend my whole life with me. You need to follow me around. No patient would ever say that. but I think it's okay to demand a connection from your doctor. And I actually did that recently. I've written that whole book and it was still hard for me. It took 2 visits, nothing happened. There's no connection. It's also related to my son. So I'm very anxious about it. And I call her, and on the phone I said, look, I'm afraid and anxious, and you really need to give me more information. I know we spent a lot of time together, but my son was there. I still feel completely lost and in the dark. You need to tell me. And I was telling myself, if she doesn't give me what I need right here, I'm going to ask, my next question will be, who do you recommend? I need another opinion. And just be honest with her about that. And I think every patient does need to be able to say that. Doctor, I'm not sure I'm getting what I need from you. Is there someone else that I can see? And I think as a doctor, yes, that's something that I would hopefully never hear from a patient, especially if I think I'm doing a good job. But that's the feedback that doctors do need, because I did get that kind of feedback too. That's in the book, where I was like, wow, I failed. She never wants to see me again. But I think that also is the type of work that needs to be done. And, it's like, is that the type of doctor I want to be? No. And I recently gave a talk on doctor-patient connection to my department, and they're like, yeah, but it's systems, it's systems. You only have 5 minutes to see a patient, or 10 minutes. That's not by doctor choice sometimes, right? I'm like, yeah, it's not. But the connection piece of it, it really, it's like a minute or even less. And I think that's what I just was never taught. And so that's what I mean. Just be aware of it. And even just say, like, be honest, we're humans. Doctors are humans. I don't think patients expect us to not be human. And I think that's where the failing is. When we come across as not being human, that's when the connection is lost. And I think to just be able to say, look, literally, and we can blame the system. The system is giving me 5 minutes with you. And even, I'm already running late. I'm sorry. And okay, I'm going to run further behind now, because I'm going to give you as much time as I can, but it might still not be enough. And so then either let's schedule a follow-up, or you call me. But yes, to a certain amount, the system is broken, but that doesn't mean that we can't connect at least a tiny bit. And then we meet again and we connect a little bit more. And then we meet again and we connect a little bit more. And I'm not saying that we need, that my plan is to become best friends with my patients. That's not what I mean. But we do need to create a safe space for the patient to really be able to say what they want to be said, what they want to say. And if it's really that, doctor, I want a cure. And if I say, honestly, it's not curable, and then they say, okay, I want another opinion, then I think it reduces burnout for doctors, because it's like, okay, here, go see this doctor. And then hopefully, right, I'm not wrong. And hopefully that doctor also says there's no cure, and then at some point, hopefully, right, the patient understands. And I think most patients will understand. But say the patient then sees another doctor and is like, no, there is a cure. Then hopefully they can still come back to me and say, even if it's a phone call, even if it's a quote unquote nasty email, right? But just say, doctor, you were wrong. This is actually my disease. And this is actually what the doctor you told me to go see told me. And that's what I have. And then I got this treatment and now I'm better. Because that's how I will become better too, right? And then the next time that happens and a patient comes, I won't just say, oh, it's incurable. I'll say, okay, I don't know. I think it's incurable, but here, go see this doctor, right? Then hopefully there's some kind of learning from getting that feedback. And I think when patients continually hold themselves like, okay, I'm not going to be human in this interaction, because they're mimicking the doctor, the authority figure. The doctor doesn't seem human. So we mimic each other. And I hope that can stop. And I'm naive. I'm an idealist, but I don't think it needs to take a lot of time. And it can't take a lot of time, because the actual medical problems are also very time consuming sometimes. There are real medical problems that need to be focused on, and time has to be spent on that. But I realized, at least for myself, and I actually do think that I'm a demanding mother of a patient, but I'm not demanding that someone sit with me and hold my hand for 15 minutes. That's not what I want. I don't want that. I do want the doctors to focus on the actual problems. But I realized that when they solely focus on the problem and don't explain anything to me, and don't acknowledge that I'm actually there too, like it doesn't matter that you have all this knowledge in your head. I don't know any of it still. You haven't told me. It's not good enough. And patients, they don't really get it. Like the patients who trust me when I'm like, oh, that's a seborrheic keratosis. Some of them are like, okay, let me write that down, or can you type that out for me? But a lot of them are like, okay, doctor, and I used to think that's bad. But I'm like, okay, to them, it's not an anxiety producing problem. Or even if it was, they trust me and they're like, okay, she's saying it's fine. It's whatever she just said it was. I don't need to go look that up, and that's okay. And I feel more comfortable now of patients who do seem anxious. I'm like, okay, you still seem worried. And I'll say, I'm going to type it out for you. Go look it up. If you get scared, call me. Do you want another opinion right now? I'll just offer it to people. And some of my patients will say, you're so busy, I can't get in to see you. I'll say, okay, do you want me to refer you to one of my colleagues? Because I don't have much clinic right now. I do at most like 3/4 of a day. So I'm like, yeah, I know. It's like, if you can't come on a Tuesday, it's hard to see me. So let me refer you to someone who has more days of clinic. That's easier for you. That's fine with me. I am replaceable. And I think that is important too. I'm human. I'm finite. No one can win the battle against death, right? I'm not trying to make it seem horrible, but I think that part of my training was, okay, conquer disease, and if I was, luckily for most dermatology diseases, it's not fight against death, but we do have melanoma. We can be I was recently the first one to diagnose breast cancer. It was, Paget's disease of the nipple in a patient. And that can seem like a death diagnosis to a patient, right? And that's where I think that Man's Search for Meaning book comes in again. We need to be able to just sit with someone in a space where death is looming, and that it's okay, I can still be here with you, and realize that that's the anxiety for them, and say, oh, in this situation, I think it's going to be okay, really, and be able to talk it through. But when the patients don't have the trust, they don't ask any of those questions. And I know I'm not alone in this, because all of my friends, my family members, they come away from doctor's visits and they have tons of questions, and they'll ask me, and they didn't ask their doctor. They'll say, you need to call the doctor. The doctor's too busy. Call the doctor and leave a message. The doctor's too busy. I was like, well, just do it. And then if they still don't call, let me know. But you should be able to ask that question, and because the questions aren't like, 10-minute questions. It's like, for that doctor, probably like, a couple sentences. And then the doctor will learn, next time I should give this information in the visit, so I don't get a call back from the patient, and then I need to spend my time calling them, right? So all of this is the feedback. But since patients are being so polite, they don't call. And then we think we did a great job. Oh yeah, all their questions are answered. My patients don't call me. They're not calling me because they think I don't have time for them. So it's a really long answer, but that's how the book came about. And I think a lot of it's Mickey Mouse, because really, you don't need to read the book. It's like, just be aware that what I see, what I hear, what I think are the emotions going on are not the same as what the patient sees, hears, and feels. And just if both parties are more fully aware of that, because that's actually a psychological concept that I'm forgetting the name because this isn't my field, but we all think that someone else sees our insides. It's that classic thing of when you're in elementary school or middle school, that first time you like someone, and you're like, oh, they totally know I like them, and like, of course they know, and you're all embarrassed around them, and you're like me, probably super silent around them. So actually they have no idea for the most part that you like totally have a crush on them, right? Unless you say, oh my gosh, I totally have a crush on you. You know, I mean, sometimes people do know, but I would think most of the time we don't know. We actually, human beings actually cannot really know what's going on in someone else's head, especially a stranger, and sometimes especially a family member, right? But so when you think about, can you read, you know, say you've been married for like 50 years, can you read your partner's mind? Some people can, but I would say a lot of people actually can't. You know, you're still surprised by someone over and over again. And so for the patient to think, oh, the doctor knows what I'm thinking, the patient's wrong. For the doctor to think, oh, the patient knows, like I had all this stuff in my head and the patient should know. They don't know. But I didn't know either. I had no idea. I didn't know any of this stuff. And I didn't realize how much better a job I could do with just some simple things. And it really starts with awareness. And so in the book tells some of my own story more. And because anecdote story is what human beings relate to. I do believe that's true. And then there's black pages where there's just some simple tricks. And they seem really silly, actually. But I have gotten the feedback happily that people are like, oh, yeah, these things work. And I'm glad that they tell me, because I'm like, oh, okay, I guess, you know, they weren't doing it either, you know? So I'm excited and hopeful, because I think on an individual level, there's systems change that absolutely needs to take place. But on an individual level, we can make a difference. And I think what excites me the most is that my childhood dream of being a doctor and, you know, the naive view, I'm going to help someone. It is like, it can happen. Like, you know, even in dermatology, like even when the problem isn't huge, and I'm not putting down dermatology, I just mean that really any important relationship, we can be conscious of making it better if we want to.